Καλημέρα σε όλους. Αγαπητέ κύριε Πρόεδρε, κύριε Μπακατσέλο, αγαπητέ κύριε Λιακόπουλε, κυρίες και κύριοι, είναι μια εκδήλωση, μια εξαιρετικά σημαντική εκδήλωση, αυτή η εκδήλωση του HealthWorld 21st Annual Conference, στο οποίο επιτρέψτε μου να μιλήσω στα αγγλικά, διότι έχουμε ένα ακροατήριο το οποίο ακούει έτσι και ομιλεί την αγγλική γλώσσα, οπότε είναι και μια ευκαιρία να μας ακούσουν και στα αγγλικά, αλλά κυρίως βεβαίως και όλοι εσείς οι οποίοι βρίσκεστε εδώ σήμερα. So, I would like to thank you for inviting me to the HealthWorld 21st Annual Conference, and I would like to congratulate the American Hellenic Chamber of Commerce and especially its president, Nicholas Bakatselos, for this initiative, as well as the president, Mr. Liakopoulos. In fact, that we are here in person today is an indication of our new normality. It is a great honor to be here among distinguished speakers and audience and discuss such an important topic. Every industrial revolution gives impetus to the evolution of health systems. The fourth industrial revolution finds the mental health sector moving dynamically from institutional psychiatric care to community-based mental care services. In this frame, modern and flexible mental health services are needed. We are investing in models such as mobile units that can provide services to all citizens, even in the remote parts of our country. At the same time, the new era of digitalization is affecting mental health. Digital tools have already been integrated into mental health services while providing new diagnostic tools and following up patients after the treatment. Also, this new era has highlighted the lack of specialized services for our most vulnerable groups, such as our children and the elderly. Especially the pandemic affected the activities of children and adolescents, including specialization and education, and many countries across the world observed increased anxiety, depression, and an increase in online activity behaviors of our youth. Investing in the mental health of our children means investing in the future of our societies. In parallel, the 21st century has showed that the aging population is growing rapidly. Globally, the mental health of older people has been recognized as a major public health issue. It is essential to create new specialized mental health services for the elderly who face disorders such as depression and dementia. It is crucial also to strengthen services for family support. It has been showcased that there is an increase in domestic violence and abuse worldwide. The fourth industrial revolution will also be the era of remote working. The economic and health crisis of recent years has highlighted the burnout not only of healthcare professionals, but of workers in general as well. Through telemedicine and telepsychiatry, we are already preparing mental health professionals as well as patients for this new era of digital provision of care. In this new era, mental health has been placed at the heart of the country's policy agenda worldwide. The WHO has set mental health as one of the flagships of the European Programme of Work 2020-2025. In Greece, we have taken radical steps towards strengthening mental health services as our Prime Minister created a special portfolio dedicated to mental health and addictions. Since the beginning of the pandemic, we are operating the National Helpline for Psychosocial Support 10306 to support the general population and has up to now received more than 450,000 calls. With the RRF funding, we are now developing 104 community-based mental health facilities across the country for the psychosocial support of different age groups such as adults, children and adolescents and their families, dementia and Alzheimer's patients, healthcare professionals and workers in general, as well as victims of domestic violence. Also, we are developing units for early intervention in psychosis and geriatric psychiatric programs to promote healthy aging and support the elderly. At the same time, we do not forget the importance of personal contact in providing care to our citizens, and we are developing mobile units across the country. To address the new needs and challenges of the digital era, we have created a digital map of all mental health services in our country to ensure universal services for our citizens. And in parallel, we are working on creating a telepsychiatry network throughout our country for the inhabitants of remote mountainous and island regions, and now we operate such units in Castellorizo and Simi. The use of digital tools are also helped us to respond to the pandemic by providing, during the pandemic, in our hospitals, telecounseling via tablets, not only to our patients, but to families and healthcare professional workers as well. We also acknowledge the significance of international synergies, and we work closely with the WHO Europe, which always stands by our efforts. In the spirit, in July 2021, we had the honor to organize a summit in Athens in cooperation with the WHO Europe, and for the first time during the pandemic, a pan-European mental health conference was convened in our city with live participation from 53 countries. The summit led to the adoption of the Athens Declaration by the 53 member states of WHO Europe, a shining example of cooperation and solidarity that promotes the mental health and well-being of all our populations. Furthermore, we inaugurated the new WHO Athens Office for Quality of Care and Patient Safety, and in this frame we developed a new European program on the quality of mental health services for children and adolescents. As our Prime Minister Kyriakos Mitsotakis stressed, the journey towards collective mental health is a long one. So we all work alongside with a vision to provide high-quality, community-based, people-centered mental health services to all our citizens, stigma-free and with no exclusions. And our mutual goals are strengthened in practice when working together in forums like today's. I want, therefore, to congratulate everyone for your excellent work. Thank you very much for your attention.